And we are back to Health Unlock, the power of salutogenesis with Jasen. Jasen, how are you?
I'm doing pretty good.
We are taking our decentralized healing path to episode 2 today. And I know we had a lot of concept in the last episode, and the last episode ended with a rather hard questions. Will enough people set up to fund this? What happens if they don't? Let's start there.
Okay. So I know that I kind of framed this as a funding problem before, and that's probably not really true, or I guess that's not really the core issue. IBAL will eventually reach the world, and well, heck, it's already happening for wound healing. We've proven that it works. It's dramatically safer and more efficacious than conventional approaches. You know, it is able to address the cellular root causes rather than just kind of treating the symptoms like cryogenic treatments do. And really, what's that mean? The technology is kind of too good to stay hidden for forever. And the real question isn't whether IBAL reaches the people, it's how. And if we can't build a large enough community around this and establish governance that protects the mission, then IBAL is going to get acquired by VCs and pharma. They'll fund it, develop it, and deploy it to maximize the extraction and thereby limiting access. And that's not hypothetical. And I don't mean to, call it a conspiracy or something. That's just their playbook, right? They find something promising, acquire it, price it for maximum profit, restrict access to maintain their margins, and the technology reaches people, at least some people for sure. The wealthy ones or the ones with really good insurance, and everyone else kind of has to wait or go without. So the stakes aren't that IBAL will never happen. It's the stakes are that IBAL happens wrong.
And yes. And you also introduced the concept of obviously, I like to say it, non-profit arm, the Ionic Alliance Foundation in last season. And we talked about this briefly, but can you recap it, what it is, and why did you structure that as a non-profit arm?
Sure. So the Ionic Alliance Foundation is a 501c3 nonprofit. It's a public benefit corporation or company. The mission is to advance salutogenic science and IBAL technology to restore the body's innate capacity to heal. I guess we structured it as a nonprofit deliberately, primarily to ensure that we could protect the mission. C3 is legally bound to operate for public benefit, not shareholder returns. And that's that structural protection against someone coming in and then redirecting everything towards profit maximization. And so that the mission kind of gets locked in at the legal level there. The IP structure reinforces this also. The IAF controls the licensing rights. We patented IBAL not to really monetize it per se, but to ensure that no pharmaceutical company could patent it first and then either bury it or tell us we couldn't develop it. Commercialization is then managed through, manufacturing, development, and distribution partners, including the Ionic Alliance Group and Ion Biotech Mexico, and other companies. But IF retains the licensing authority, I suppose. Nothing moves forward without mission alignment. And so that we built that structure to protect against extraction from day one. The IP is really controlled by the inventors who care about the mission. The nonprofit is then ensuring public benefit licensing, or as the licensing authority is centralized where kind of mission matters the most. But I guess, so here's what I've come to understand, right, is that the nonprofit structure isn't really enough all on its own. If a well-funded VC or pharma company wants to partner, license, or scale this globally, they can make offers that are hard to refuse. And, the IAF's board might kind of hold the line, but what if a future board doesn't? Or I guess the current board. What if a future board doesn't? And what if the pressure there becomes too great? What if, someone makes an argument that reaching more people faster justifies compromising access or pricing? And I guess the nonprofit protects against outright sale of the IP. It doesn't protect against the slow drift towards extraction through partnerships and licensing deals and stuff like that. For that, we kind of need something more.
And at any point before this, was there a thought about DeSci involved in that once you were initially establishing this, or even a centralized governing model that you had in mind, or you heard about it previously?
At the time that we put the IF together, no.
Okay. And let's talk about this a little bit. Something you mentioned here. You said that the nonprofit isn't enough by itself. What happens when a VC or a pharma company comes to you and knock your door and they want to take over or whatever? What happens actually?
They'll probably fund it. That's not the problem. It's proven technology at this point with regulatory approvals and revenue, even if the revenue's not a lot. But VCs and pharma aren't stupid. They can see the potential. And if we wanted traditional funding tomorrow, we could probably go get it. The problem is what comes with that funding. So venture capital wants an exit. That means either a pharma acquisition or an IPO with kind of growth at all costs pressure. And their VC timelines are normally 5 to 7 years. Their target is next to 100x returns. And so every decision then really gets filtered through the question of, does this maximize exit value? Does this maximize patient access or, our mission? And, pharma will license or acquire, but they'll then develop it their way. As we kind of touched on, that's premium pricing, restricted access. They might pursue the indication with the best margins and then ignore others, or I guess slow roll development to protect existing product lines, or price it so high that only the wealthy or well insured, I suppose, can access it. And again, I don't say that as some big conspiracy. It's just how their incentive structure works. Their job's to maximize shareholder returns. Our mission is to maximize patient benefit. And those aren't the same thing. And when they conflict, shareholders can win. I'm not entirely convinced that something like a benefit corporation can really work. But so, I mean, impact investors and family offices would be better aligned. But even when they often want kind of pharma, or I guess what I'm trying to, even they often want pharma style governance. That's, board seats and veto rights on partnerships and exit provisions and all that kind of stuff. The strings aren't necessarily quite as tight, but they're still there. And so again, the question doesn't really become, can we get funded? It's more, can we do this without handing over governance to people whose incentives don't match our mission? That's why we're building the IAF DAO, because we need a way for the community to govern this, or to govern how this technology reaches the world. And decentralized governance then means that no single funder can redirect the mission. The community can kind of help hold the line, not a board that might buckle under pressure.
And what, for our listeners who have not heard this before, what is a DAO?
Okay, so DAO stands for Decentralized Autonomous Organization. That might sound something out of a sci-fi movie, but it's really fairly simple. It's a way for community to make decisions and manage resources together using blockchain technology. You can kind of think of it like a co-op where members vote on decisions, or like open source software where the contributors shape the project direction. Or, this is probably the best analogy for us, like a nonprofit board, except that the board is everyone who owns and holds the governance tokens. So instead of, 5 people in a room deciding how things go, you have 5,000. And there are a few properties that make DAOs different from traditional organizations. First of all, you've got transparency. All the votes, Treasury movement, and decisions are publicly visible on the blockchain. So you can't have any backroom deals, no hidden agendas. If the IF spends money, you see where it went. And if, we enter a partnership, you get to see and review the terms, and, try getting that from Pfizer. that might be difficult. Then there's also participation. So all the token holders can vote on any of the proposals. It's not a small board making decisions for everyone else. If you hold tokens, you get a voice. That's it. Global access. So anyone anywhere can participate. Someone in Brazil or India has the same governance rights as someone in California. Geography doesn't then determine who gets a say. And then programmability. And this is kind of the nerdy one. The rules get encoded into smart contracts that execute automatically. If a vote passes, the action happens. There's no waiting for someone to implement it, no, getting to it next quarter and such. The code just does it. And I assume that some people would hear this and think that sounds very experimental. And while it's relatively new for sure, it's not completely experimental. The DeSci infrastructure organizations such as VitaDAO and Molecule and LabDAO, and there are a bunch of others. They've been operating for a few years now, funding research and medical research and science through decentralized governance. The DeSci sector does have a track record at this point. And the innovation that we're really kind of talking about here with IAF isn't the DAO structure itself, it's what we're using it for. Most DeSci projects are using DAOs to fund speculative research that, might work out someday. We're using it to govern proven technology that's already helping people. And then the community gets to decide how IBAL, in this case, reaches the world, as opposed to a small group of funders who might prioritize returns over access.
Yeah. And do you think that having too many people decision then that slows down things sometimes?
Well, no, because they don't have to vote. Once a vote is initiated, there's a certain time that the token holders can come in and click a button, yay or nay. And if they don't, they don't. And that's perfectly okay, right? Because we might have multiple projects going at the same time, one tied to diabetic foot ulcer, one tied to cancer. And, a bunch of the people who really want to focus on cancer, they might not care about what gets decided on the DFU side, and vice versa, in which case that's fine. They don't have to. They can come in and vote when they care. And that, that makes things a little bit more flexible, but also more functional. And it's significantly faster because there's no counting. You don't have to do any of this stuff. It's all built into the smart contracts.
Yeah. Definitely if it's time bound, and definitely it's on blockchain. So there's transparency and it is faster implementation. There's no bureaucratic steps involved there or influence in that matter for to handle those things. So I guess the question is, what makes a DAO the right structure for health innovations specifically?
So I believe that healthcare's main problem is that it's got misaligned incentives, kind of at a structural level, right? So those who profit, pharma and insurance, don't benefit from the cures themselves. Those who pay, patients and employers and even the government, have no governance power over what gets developed. And the government does a little bit, but more in a way of saying, no, you can't do that, or yes, you can do that, not do this. And those who develop, the researchers and the inventors of things, usually have to relinquish governance to secure funding in the first place. And, you want capital to scale, you give up control, and that's kind of the deal. And the DAO or a DAO kind of breaks that deal. Patients can now participate directly. They can buy tokens, have governance rights, shape how the technology that, they care about gets deployed. And it's not, hey, we'll build this for you. It's help us decide how to build this. So, kind of a different way to present everything. And I mentioned that the nonprofit alone wasn't enough. The DAO also adds kind of a second layer of mission protection. You have the 501c3 structure, which legally binds, all of this to public benefit, plus the community governance that then ensures that decisions stay aligned with what the community wants. So no single funder, no future board, we discussed that, can override, thousands of token holders. The other thing that's interesting here is that transparency is built in. Everyone gets to see where money goes and what decisions are being made. There are no hidden budgets or buried data or backroom deals with partners who want to again, maximize extraction. That's kind of what they always want. You touched on this a little bit, but the speed of operations really actually improves dramatically. There's no need to wait for that quarterly board meeting to be scheduled. Proposals can get moved through within a matter of days when the community agrees. As we mentioned before, it's also globally accessible. So someone in Brazil or India can participate the same as someone in the US. Geography doesn't determine who gets a vote in how the technology reaches the world. So for the IAF specifically, this means that the community decides which initiatives or indications to pursue. Should we prioritize diabetic foot ulcers, psoriasis, cancer applications? The community then gets to decide the geographic priorities. Do we push FDA approval, expand in international markets where we're already approved, which is in Latin America and or the UAE? Each kind of new IP bundle, if you will, whether it's a new product or indication or delivery method or even geography, is then governed by the DAO's token holders. So it moves all of this away from raising money to ensuring that the technology gets developed in alignment with our mission, and having this DAO structure that can't, and I guess I won't say can't, but it would be very difficult to capture this be captured by extractive interests, kind of no matter what pressure they apply, is among the best ways that I've ever seen of trying to do this.
So I guess the decentralized crypto projects and, American healthcare seems like a strange bedfellows, right? So how does what you are building align with the current healthcare priorities? That's a big question.
Okay. Yeah. So they might seem like strange bedfellows for sure. But what we're building really aligns directly with the stated national priorities, at least now. The whole kind of make America healthy again isn't just a slogan. It's driving real policy conversations about addressing root causes rather than just managing symptoms, and reducing healthcare costs that are bankrupting, families and the government. And also bringing manufacturing back to the U.S., especially for critical medical products, and reforming regulations to enable innovation. The IAF DAO aligns with all of that. U.S. manufacturing, right? IBAL can be manufactured domestically. We're not dependent on foreign supply chains for critical medical technology. We've got cheaper treatments. The device pathway costs a fraction of drug development. We've talked about that a bunch. And we're talking, hundreds of thousands to millions versus billions. And those savings can get passed to patients and not extracted as profit. You've got safer treatments. Since IBAL is non-pharmacological and it works with the body's natural healing processes rather than forcing change through whatever synthetic chemistry. You've got the kind of this root cause focus. So the whole microimmune dynamic framework addresses why cells are getting stuck in the healing cycles in the first place, not just suppressing symptoms of what that causes downstream. And then there's, here's where the DAO structure actually strengthens that alignment, right? So the administration wants transparency and accountability in healthcare. A DAO puts every decision on chain where anyone can see it. Treasury movements, votes, partnership terms, everything. And that's more transparency than any pharmaceutical company offers. That's more accountability than any traditional nonprofit board provides, not necessarily because, we're such better people, but because it can be kind of a pain for every decision you make. Okay, well, somebody has to take that, put it together, write a little report about it, and then issue it. You don't need to do any of that. It's all online. It's all on a blockchain. Anyone can look it up anytime they want. Then I guess there's also something to be said about that community governance aligning with the populist energy around healthcare reform. People are really getting tired of corporations deciding who gets access to what treatments and at what price. And a DAO flips that. The community decides. Patients and practitioners and citizens who care about health, not shareholders who care only about returns. And I don't want to, I'm not anti-government or anti-regulation, although sometimes I am. We're trying to build something government could actually partner with, a model for how healthcare innovation should work. And this isn't a theoretical alignment either. We've talked about this before. A retired general was so impressed by the results that he saw. He's facilitating a presentation to the deputy director of the VA. And his goal is the potential inclusion of IBAL in the VA's alternative cancer care pathway. And that's not, this crypto bro culture or whatever you want to call it. That's demonstrating value at institutions that serve veterans.
Yeah. Would you, I guess the question here is like, a lot of this is already existing in many ways, right?
Mhm.
Still. So why haven't we seen any, I guess, bigger success stories in healthcare specifically? What do you think is the reason for that?
Well, it is kind of still brand new. I mentioned that DeSci has been around for a few years, and a few of the companies are already, I guess I shouldn't say companies, a few of the DAOs are already operating. They're operating via governance, so they're not, well, maybe I'll back up. Probably the biggest issue is that DeSci currently is still focused on early research. Nobody else has come to the table and said, hey, we've already developed this wonderful technology. We'll just kind of give it to the world and let the world govern it and govern what we're going to do, right? We've already put in all the money to develop it and, took all the risks. Now, you guys get to benefit by deciding where things go. And to some extent, I kind of compare back to, I totally forget the name, whomever developed insulin, but they felt strongly enough that it needed to be available to the world. And so they sold the patent for like $1, but it still ended up then going into pharma. And it was just a couple of years ago that insulin prices were going crazy. And people couldn't afford it. And so obviously just taking your wonderful IP that can save the world and giving it away doesn't work, because the people that you give it to can still use it in an extractive manner. That's what we're trying to do, is fix that. But again, no one's done it yet.
Yeah. That would be the biggest challenge in handling this. But some people hear the word tokens and assume it's like all the crypto hype or the scams that's happening. So what's different here?
Yes, valid concern. The crypto space has plenty of speculation and outright scams. So it's worth being specific about what makes this different, right? And that key distinction is this is a governance token, not a speculative token. So meme coins really have no utility. You buy them hoping somebody else will buy it in the future at a higher price. And that's pure speculation. There's no underlying asset. There's no underlying functionality or utility, no purpose beyond trading it. And, to some extent, that's okay, because the meme coin is tied to some kind of social idea. And as that idea increases in awareness, well, then you hope that the meme coin tied to it increases in value as well. That's not a great connection. So let me first walk kind of through what token holders actually get with the token that would be tied to the IFDAO. First and foremost is the governance rights, right? So they get to vote on which development projects to pursue, which partnerships to approve, how whatever pricing, humanitarian pricing works, how the Treasury gets allocated. So those are all real decisions about how IBAL is reaching the world. So that's one thing. Another thing, second thing, is validator participation. You've got scientific, regulatory, financial, and humanitarian validators that can earn compensation for verification duties within the ecosystem. And so then you can kind of contribute expertise to get tokens. You don't have to contribute cash. Third is there is some utility. You can actually pay with I'm hoping that it will be an IBAL token with a, $sign IBAL. So let me just start calling it that, IBAL tokens. and get a certain percentage off of IBAL cosmetic products. That can then create kind of real demand from actual end users, not just traders. And then I guess fourth, you've also got a rebate mechanism that's kind of bundled into that. So when a customer then pays cash for those products, the IAF takes, whatever, 20% of that revenue, buys the token on the open market, and then deposits into the token holder's wallet, whomever was purchasing that cosmetic product. And so that's kind of structured as a customer acquisition and loyalty program. And there's established precedent for that model with Rekt. It's REKT, which is a drink company. They've basically put together a brand meme coin. But also beyond utility, the token is connected to real assets. There's proven IP with regulatory approvals from currently it's Cofepris in Mexico, MOHAP in the UAE. And there's revenue generating products already on the market. And then you've got the 501c3 nonprofit structure kind of protecting the whole mission. And yeah, so you could go and buy the IBAL token and never vote, never participate in government's decisions and never engage with the community, but you'd be missing the point. This isn't really about just hoping that, this value goes up. It's about having a say in how this technology reaches the people who need it. Hopefully that differentiates what we're trying to do enough from, just another meme coin.
And what about the regulators? Like, how do you navigate, something like this without running afoul of securities laws or something else?
Yeah, actually, it's a big one. It gets a little bit technical, so stick with me. But so the standard test for whether something is a security or not is called the Howey test, and it comes from a 1946 Supreme Court decision about like orange groves of all things. So for something to be classified as a security, all four elements have to be present. So miss one and it's not a security. So let's walk through them real quick. First one is an investment of money. So that's unavoidable for any purchase token. We can't get around that one. So that's 1 out of 4. Second is what they call common enterprise. And so common enterprise means that everyone's money is pooled into a single venture that succeeds or fails as a whole. That's not what we have. The IAF already controls the foundational IP. There's no pooling of funds to acquire it. Token holders govern licensing and deployment decisions across multiple independent projects, each one with different economics, each able to succeed or fail on its own. That looks a lot more like a foundation licensing its IP to numerous independent entities than investors pooling funds to start a single company. So we think we can avoid that one. The third one is the expectation of profit. We can avoid this too, because there are no contractual returns. There's no guaranteed revenue sharing. Actually, there is no revenue sharing, and there's no fixed buyback schedules. The token supply itself is variable, so you can't predict when new tokens are minted because they're tied to new IP NFTs. Remember, those are intellectual property, non-fungible tokens. Basically, that's whenever new things are released off of the base or the foundational IP, we'll bundle that into a new little IP NFT. So there's some value behind it, if you will. But the creation of that's not a fundraising calendar. The primary purpose of that is governance, not investment. Plus, there's the utility built in with that cosmetic distributorship agreement, and token holders get discounts and rebates on the cosmetic IBAL product sales and that kind of stuff. Fourth is the efforts of others, and that's one where most crypto projects kind of fail on this. They're basically saying, "Hey, buy this token and we'll build something valuable," is basically the definition of depending on the efforts of others. But in our structure, token holders exercise real control. They vote on products, approve terms, select partners, and reject proposals, whatever. Again, the base IP already exists. It's not speculative. The efforts of others are simply the extraction of licensing decisions that token holders govern. And so our position is that we meet one of the 4 Howey elements, and that matters. Actually, so here's another thing that might strengthen this further. And it's unusual in the crypto space. Even the founders can't access their personal token ownership until we reach what we'll call net positive status. And I'll explain that more in a minute. But the short version is we literally cannot extract value and disappear. Our personal allocation is locked until we've demonstrated, or until the IAF has demonstrated, the project has returned more value than it's taken. And those performance metrics are governance and impact based, not just token price based. So that actually might sound like, oh, this is getting close to security. Well, no, not at all, because the DeSci sector kind of has precedent here, right? So Vita, DAO, Molecule, and such have been operating those governance tokens for years without SEC enforcement. And the IF actually has a stronger positioning than typical DeSci products. One, we've got the 501c3 structure. Two, we've got the proven IP with regulatory approvals already generating revenue. Three, we've got the multi-entity ecosystem. So the IAF will then fund different entities to do different things. Then what number are we on? 4, we've got a variable supply of the token, which is then tied to IP governance. And then the 5th one is you've got real product utility from day one. And I understand that's a lot, so I'll try and wrap this part up. I want to be a little bit clear that we're not trying to evade regulation here. We're building something that we generally believe isn't a security because it's governance over existing assets, not investment in speculative ventures. But I guess if we're ever challenged, we do have some prepared responses. One is the legal defense based on how we avoid 3 of the 4 Howey elements, a compliance transition path to develop a compliant security token structure if it's required. So if we had to convert and create a token that actually was a security, we can do that. And then kind of use a surgical feature migration, I suppose, where we move the questioned features into the compliance structure while keeping the core governance operating. And so the whole point is that we want governance, not just funding. Funding happens as a byproduct of people wanting to participate in the governance. If someone never makes a dollar, but helps govern decisions that get IBAL to 1 million patients, I'd still call that success. And that's kind of the whole point.
I guess the question here then is like, what is the people who are being part of the DAO and, they are trying to support you? What's their exit then, right? And that's the question. How do they make money?
Well, okay. So first off, them making money isn't the primary goal. Is it going to happen? Yeah, I'm sure it's going to happen. But if you were nothing but an investor, right? So let's step back and try and put on a different hat. You're nothing but an investor. Or would I think that this is a good way to make money? I actually would. All of the benefits are pointing towards the fact that this will actually work better than normal. So, what normally happens? What normally happens is a VC puts money in, and then whenever you license things, you basically, the VC gets paid back. Normally that's by selling off the company, and then they own a percentage of it and such. But in this case, no one owns the IP, but I guess the inventors. It's just that you can license things off. And as money is made, the DAO will then store that money back into the Treasury. And that's not automatic. The DAO gets to vote on whether to store it as cash, whether to turn around and use it for humanitarian things, which actually is perhaps something else I should have mentioned. One of the outputs is not, or one of the desired, how should I put that? One of the desired goals is not, hey, we've made money. It's how many people have we actually helped? And the DAO could actually vote, hey, rather than taking, all of the money that has just come back in through one of the different distributor partners or development partners, so on and so forth, rather than taking all of that money and converting it back into the token, which would likely increase the value of the token, we can take some of that money and, distribute product to people in need. So it's another way it doesn't make money. But to go back to how it makes money, everyone is already extracting money from companies, whether that is the funders or the founders or banks. And the way that we're trying to set this up is, instead of all that money then going out to external people, it stays within the ecosystem. So, even if where you would normally go to the bank and get a bank loan to handle manufacturing, to put together a batch that you otherwise have sold through a distributor. Well, rather than do that, we could do that through the Treasury. And then once the manufacturer, which is another company, then pays back the IAF, whatever they borrowed plus the royalties, all of that then can go back into, or as much as the DAO wants, can go back into the Treasury, which ends up putting more money into the ecosystem than it's taking out. Does that make sense? And if you do that over and over and over again, well, yeah, it's naturally going to increase in value. But again, that's not the goal. The goal is to make sure that the world gets this in a way where everyone can really benefit. And sure, I don't have any problems. I would much prefer token holders to make money than some random bank to make money or VCs to make money. And if that happens as a byproduct of this, great.
Yeah. I mean, you slightly touched upon this, but walk us through how the IAF DAO actually works.
Okay. Yeah. So this is the part where I'll geek out a little bit. Spend a lot of late nights kind of designing this, so bear with me. Let's start with what the token holders actually control. That's the whole point. We've talked about this a little bit, but let's really clarify. Token holders get to vote on decisions that matter. Which development projects to pursue, which they get to vote on the funding terms for each project. They get to vote on licensing strategy and partner selection, whether that's distributors, or even if something like an injectable breast cancer treatment that might require a pharma to develop it because it costs a whole ton of money. Well, they would get to vote on whether we can do that or not. Then you've got the kind of the humanitarian pricing programs that we talked about that might be more on the nonprofit side of not making a profit. And then they also get to kind of have a say in treasury management and how those funds get allocated across different priorities and such. And so those aren't just advisory votes where, kind of a board nods politely and then does whatever they want anyways. Those are binding governance decisions. And if the community votes it down, then it doesn't happen. So now let me kind of walk through the structure that makes that work, right? So again, inventors control the complete IBAL platform technology, or the IP there. That's the microimmune dynamics framework, the core IBAL technology, all the formulations, the manufacturing processes, the clinical data, trade secrets, everything. IAF, again, that's the 1C3 nonprofit, is granted control and licensing rights. That's the mission protection layer. The IAF DAO, which is where the token holders govern how that IP gets developed and deployed. And then you've got the IP NFTs, or that's the kind of the packaged pieces or the new packaged pieces of that foundational IP. That's, each new indication or delivery method or even geographic expansion, that all becomes IP NFT with the governance structure that's tied to it, and you mint new tokens based off of that. Think of that like franchise agreements, except the community approves each one. So actually, that was an important point. Token minting only occurs when new IP NFT or new IP bundles get created. So they're not tied to fundraising schedules or any kind of predictable dilution. It's tied to actual new development pathways that need the community oversight. But it's also backed by the governance of valuable IP that's being released with it. And this is perhaps where things get really interesting, is kind of the incentive alignment along here. I mentioned the net positive kind of vesting earlier. So I'll explain how that actually works, because this is the part that I like a lot. So let's just make up a token distribution. When you mint token, we allocate, say, 50% can be sold to the community participants. 25% is reserved for the IAF and the founders. 10% is reserved for contributors, whether that's developers, validators, and advisors. And then 15% for other strategic partnerships and liquidity and ecosystem development, that kind of stuff. But so here's the important part. That 25% founder allocation isn't the founders to sell. It's held by the DAO. Actually, everything's held by the DAO until it's released to somebody else. And the founders actually then receive voting rights immediately through the IAF, but they don't have personal ownership until the project reaches that net positive status. So let me explain that. So that has two conditions that work together. First one is the economic reciprocity, where cumulative buybacks must exceed what you'd call the dilution value, right? And how's that calculated? You take the initial token sale or the initial release, and then you extrapolate that to what it would have been worth had 100% sold. So 50% of the tokens were sold for $1 million. Then the dilution value is $2 million, because even though had you sold 100%, you probably would have depressed the price. And so it's deliberately generous to the token holders with kind of that built-in buffer that favors the community. Second is impact validation. And so now the DAO also has to show and verify that the technology is actually helping people. And that's going to be determined on a case-by-case manner with DAO votes, determining what's actually qualified. What are we going to require this new project to do? And there's some flexibility in that, right? So if a better path emerges mid-project, the DAO can kind of then redefine what that impact criteria is. And so we're not locked into metrics that stop making sense at some point. And then on top of all this, these two conditions have kind of compensating weights. So a shortfall in one requires a surplus in the other. If the impact is only 50% of the target, economic reciprocity might need to be 150 or 200% of its initial target. And so, for example, if there's a market crash that prevents buying back enough token to reach this, the dollar amount, because you could buy, potentially you could buy back all of the tokens and still not reach that amount. Okay, fine. Then we would require a higher impact demonstration. And again, all of this would be decided by the token holders themselves on a case-by-case basis. And so this creates kind of a self-correcting governance, right? If you think about it, if the IAF executes well, that means that less token sales are needed to fund operations, buybacks accumulate faster, impact milestones get hit, and in that case, the IAF retains more governance influence, and the founders get their token shares get released. Conversely, if the IAF executes poorly, well then, more token sales are required, buybacks might lag, impact milestones get missed, and what naturally happens is governance starts to dilute toward the community, who can then vote for different direction and handle things better. And all of that makes sense, right? Poor execution should shift control to the others who do a better job. And this mechanism doesn't require anyone to judge whether leadership is good or bad. It just follows the math that's encoded into the smart contracts. If the IF isn't delivering, control flows to the people who might deliver. And there's no drama or coups or lawsuits or anything like that. It just happens. And, again, conversely to that, the only path to retained founder control, or to be honest, any founder share, is aligned to proper execution. We literally can't take the money and run. So try and make that concrete real quick. So imagine somebody or someone proposes, we prioritize the FDA for diabetic foot ulcers. Token holders vote. if that's approved, an IP NFT is created for that project. Tokens are minted for that specific governance need. The project proceeds with community oversight. When the Ion Gel gets FDA clearance for DFU, everyone who participated in that decision helped make it happen. They governed it into existence, I suppose. And if the founders delivered, then they earn their share. If not, control is already shifting to people who can do it better. Does that all make sense?
Yeah. I guess the question is, how do you make sure if, I guess, the founders are not living up to what's expected, and then control is shifting to the people who are taking initiatives, but it's at the end is centralized governance too. So within that, if there are more people doing than versus a few, then the control will just shift to that group itself, right? That's how it will work.
Yeah. So, but that's where the purse strings are, right? And really, the purse strings kind of control everything. And so if the founders are controlling the purse strings and doing a poor job, well, that necessarily means that they likely are going to have to sell more tokens, which erodes their control. And it means that they're not continually buying back the tokens as much as they should to retain their control. And so, and again, remember, all of this is done on smart contracts. So when things are voted on as to, I want to take money out of the Treasury to do this with it, well, if the founders no longer can control that decision, then the token holders, token holders, the community that is not the founders and not the IF get the control there.
Yeah. Yeah. And who do you see then joining this if let's say IF DAO succeeds, what does healthcare will look like in 5 years, 10 years time?
Okay, so again, this is open to anyone who believes healthcare should, well, actually, I was going to say this is open to anyone who believes that healthcare should serve patients rather than shareholders, but it's actually open to people who don't believe that as well. But let's focus on those people. So more specifically, anyone who wants a voice in how that happens. You've got patients and advocates, especially those with conditions that conventional medicine isn't resolving or can't resolve or is too expensive. You'd have direct governance, power over what gets prioritized. If you're suffering from whatever, wounds, psoriasis, chronic infections, that nothing seems to help, you can prioritize decisions about, whether we pursue your condition next, not as a consumer just waiting to be served, but as a governor shaping the direction. Then you've got practitioners. I expect them to get involved. You've got nurses and doctors and integrative health providers who really see kind of terrain-based approaches, but can't access them at scale through their normal channels. And they can help govern the deployment strategy, decide which delivery methods get developed, which markets get prioritized, how practitioner training programs get structured, all sorts of things. Then you've got the DeSci community. And, this is an opportunity to prove that decentralized governance can do more than just fund speculative research, which is kind of where they've been stuck mostly, right? We're showing, or we hope to show, that it can steward proven IP and ensure mission-aligned deployment. So that's kind of a new model for the whole sector. You've got health-passionate citizens, anyone who wants healthcare to work differently. You don't need to be wealthy to have a governance vote here. Participation at any level matters. One token, one vote on the decision, or the decisions that shape how this technology reaches the world. And I know I said one token, one vote, but there might actually be a quadratic formula in there somewhere where someone can't just buy up all the tokens and make all of the decisions. So the more tokens that you have, that you purchased off the open market, with every new token that you get more vote, but not another full vote. However that works. Let's see, you've got mission-aligned investors, family offices and impact investors who want returns and impact. We've actually talked about them. This isn't either or necessarily, but understand that, they'd be joining as a governor, not just a capital provider, and their voice matters because they participate in governance, just, not just based on the size of their check. And then you've also got even researchers, right? So they help validate the microimmune dynamics framework, contribute to the indication expansion, earn validator compensation for scientific verification, and then, help shape the evidence base that determines which directions we pursue in the future. So if the IF DAO succeeds, what's healthcare look like in 5 years? I would say there are multiple countries with IBAL access deployed through mission-aligned partners, not extractive licensees. You've got thousands, hopefully more than that, patients are served annually with humanitarian pricing, ensuring that access isn't limited to the wealthy. We've got multiple indications validated and approved, prioritized by the community based on need, not just profit potential. But I'll mention this. It is okay for the community to say, especially early on, hey, maybe it makes sense to develop this first because it's one of the bigger markets and we can get to where, everything is self-sufficient sooner. That's okay. It's perfectly fine for the community to decide that. Okay, so let me keep going. So a self-sustaining ecosystem, which I guess is part of that, where the governance continues because it's valuable, not because we're chasing capital. So to be clear, even after the IF DAO no longer needs to raise funding or no longer needs, or how do I put that? The funding isn't important anymore because they've got, a war chest. We still want to continue this and release new tokens with every new IP NFT that gets created to ensure that we continue the governance process. So truly, we're trying to get this to completely be separate from the funding. So then, let's see, moving on, proof, right? So for that community governed medical technology can outperform the extraction model of development. So not just in ethics, but in outcomes as well. So you've got faster deployment, broader access, better alignment between what gets developed and what patients actually need. And I guess I might be forgetting some, but for now, I'll just say last but not least, healthcare cost savings, right? So in the hundreds of millions, hopefully. Just looking at diabetic foot ulcers alone, they cost over $17 billion annually in the US. If we can reduce amputations, reduce hospital stays, and reduce the endless cycle of those, failed treatments, that's real money staying in patient pockets and real suffering being prevented. But I guess also the bigger picture is if this works, it's not just IBAL getting to people, although that's great, but it's also the proof of concept for a different way to develop and deploy medical innovation entirely. Again, to recap, the pharma model extracts value, acquires promising technology, prices for maximum profit, restricts access to maintain their margins, and patients kind of their customers to be monetized. DeSci creates value and distributes it. Patients become governors, practitioners become partners, and the community decides not just whether something gets funded, but how it reaches people who need it. So if the IF DAO fails to catch on, IBAL still is going to reach the world, but it does so via the pharma way with, premium pricing, limited access, one or two indications that maximize margins while the others get ignored. Technology helps some people, mostly the wealthy, while everyone else waits. If it succeeds, we govern how IBAL reaches the world with reasonable pricing, global access, and indications prioritized by need, not just ROI. The platform potential, fully develops because the community decided it should. And I guess 5 years from now, I want to be able to point to the IF DAO and say the technology reached 1 million patients or 1 billion patients because the community governed its rollout and not because a pharmaceutical company saw a profit potential and not because some VC found an exit, but because people who cared had the governance power to make it happen. And again, if they make money in this process too, awesome.
Yeah, in a way, decentralized governance is community-based governance. That's what it feels like.
Yes, but which is interesting because I also see this as being, I think we've talked about this before, but medicine is not capitalism. There's so many protections and controls. There's no price competition. There's none of that. And so I actually think that this method is closer to capitalism than our current development process is. And I believe that true capitalism can really increase the results in better products being developed and brought to people at better pricing. I mean, heck, you can look at almost anything that the government has got involved in and said, oh, we want to prioritize this and make sure that this gets to people. Those are the most expensive things around. And things that didn't get those or that support are the cheapest things. You can look at LASIK surgery is a good example. It's only a few $1,000s. If the government had tried to mandate that or, something along those lines, I'll bet you it would be tens of thousands of dollars, if not hundreds of thousands of dollars. And then insurance would have to pay for it. And then we would all be paying for it in insurance premiums and so on and so forth. I think this is a much better way of doing things. And it might sound very socialist in intent, but that's not really how it's coming out. It lets the customers make the decisions on how to develop something for them, which that's not socialism. Socialism is having, some organized body make the decisions where it's not a very diverse body, where they don't have much knowledge and they're just making up things that they think is good. And you know what? Whenever government does that, you could say everyone's trying to do the right thing. It almost never comes out good. Almost everything that government does ends up being worse than had they just not done it in the first place.
Yeah. Well, on that note, we will conclude today's rather long conversation, but I think
yes,
we covered some essential topics here today in this conversation, and to give our listeners and everyone the understanding why this matters and how this is done and how it plays out, especially how you have explained it today. We'll be back again with the next episode and go more detailed into decentralized healing. But for today, we'll call it today with this with this statement. Thanks for being with us, to our viewers, and listening to Health Unlock, the Power of Salutagenesis. We'll be back. Thank you, Jason.
All right. Thank you.